Hello everybody, welcome to my channel. This is a very important video that I had to share with you. Very important information because a lot of women were surprised when they saw this video I'm about to play. Basically, we're told to go to the OBGYN when we're as young as 18, even if you're not having SMEX, because they want to, you get a pap smear and they will check and see if you have HPV and if you have any kind of cervical cancer. And a lot of times, a lot of us were led to believe that they will tell you if you have ovarian cancer, PCOS, endometriosis, all types of problems that relate to your vagina is what you usually think. Well, you'll be told this when you go to the OBGYN. Well, this doctor is sharing that pap smears do not screen for ovarian cancer. So I was looking through the comments and I'm going to share some comments from the video where women were like, well, what on earth do we ask for? And why come the doctors, the OBGYNs, why didn't they tell us that they're not looking at our ovaries and if we have ovarian cancer and all these types of problems? No, they don't do that when you get a pap smear. So a lot of women learn something new. I'm going to tell you what you have to ask them for, what you ask them for when you go to the OBGYN. Let's get into this video and I'm going to tell you more, okay?
Pap smears do not screen for ovarian cancer. They do not screen for uterine or endometrial cancer. They do not screen for vaginal or vulvar cancers either. They do not screen for infections. They do not screen for causes of pain. You could literally be bleeding between your periods, feeling bloated all the time, or having pelvic pain and still have a normal pap smear result. Pap smears only screen for cervical cancer. That's it. I've seen women feel blindsided by a diagnosis because they thought they were in the clear after having a normal pap. So here's what a pap smear actually does. It looks for abnormal cell changes on the cervix, especially those caused by HPV. HPV may be tested, but it's not always ordered by your provider. If your pap smear is normal, it is a great sign, but it doesn't give us any information about your ovaries, uterus, fallopian tubes, or other reproductive organs. So what can you do regarding risks of other reproductive cancers? The first is get your yearly GYN exam, even if you've had a hysterectomy. Second, talk to your doctor if you're having unusual symptoms like persistent bloating, changes in your discharge, pelvic pain or pressure, back pain, weight gain or weight loss, pain with intercourse, or any kind of unexplained bleeding. And please advocate for yourself. If something doesn't feel right, speak up. You know your body, and if something feels off, we investigate, even if your pap smear is absolutely perfect.
Okay, so again, this surprised a lot of women. Basically, you have to ask them for a transvaginal ultrasound. Okay, you're gonna get the ultrasound. They're gonna stick something up you. They're gonna put lube on it. It's not gonna be painful. I've had one of these before, and it will show them everything. They will know if you have fibroids. They will look at your lining. If your lining is too thin or too thick, it will look at your ovaries, everything. That's how you'll know what's really going on when it comes to your uterus, your vagina, your ovaries, all of that. Not, you still should get a pap smear. Still keep getting that, but you have to ask them, I need to get a transvaginal ultrasound. And ladies, you must do this, okay? It's extremely important. If you have to get a biopsy, if something comes back abnormal, the biopsy, it can be very painful. Very, very painful. I'm being honest with you. Now, some women it's not painful, and for other women it can be very painful. They don't give you anesthesia. It's maybe about 5 or 8 minutes long. But it has to get done if something comes back abnormal. Now let's get into these comments that I saw. Okay. They said again, so what tests do we need? Please do your research. Again, ask for a transvaginal ultrasound or get an MRI. Okay, it will show more of what's in the inside. Doctors don't do annual GYN exams unless you request it. It may not even be covered by your insurance. Incorrect. They have gone to every, hold on, okay, I'm reading everything right here. Okay, incorrect. They have gone to every 3 years for a pap smear, and newer studies show you can go 5 years. However, they should still be offering or doing pelvic exams yearly and giving you an option to have a pap smear annually. You are correct in stating it may not be covered by some insurance, but providers can still perform them if you want to eat the cost. Okay, let's see. What's the point of the video if you don't provide a recommendation? Well, in the comments, and I'm telling you, you have to get a transvaginal ultrasound. Okay, they said again, you have to ask for the test to be done. Okay, this is sad. It's sad. I believe doctors should be more open to their patients. Okay, what's the point of going to them after a hysterectomy then? Because some women only get a partial hysterectomy when they remove only the uterus and the ovaries. Okay, they're talking about hysterectomies. Let's see. Last week, my doctor tried to convince me and force me to get a pap smear. I haven't had a pap smear in years. I told my doctor to stop asking me about it because it's my choice. My choice, my body. This woman sounds ignorant as hell. Ignorant as hell. Get a pap smear still, because you can still end up with cervical cancer. Still get a pap smear. If the doctor is pressuring you, you need to get a pap smear, you probably should get a pap smear, but also ask for the ultrasound. Okay, because that type of attitude, next thing you know, you end up with cancer when you could have checked it, when you could, especially if your insurance covers it. My pap smear came back clear. I had an ultrasound because of abdominal pain that I thought was female related, and they couldn't find anything. They said I have a small cyst. They'll look for that too, and a polyp. They will also look for a polyp possibly, which can also turn into cancer. So yes, the ultrasound, the ultrasound. Okay. I get ultrasounds every year or every 6 months. It should be a protocol. Even though doctors say you don't need it, request them. My 12-inch tumor grew within 4 months, but I got that doggone ultrasound. Okay. Um, so should I cancel my pap smear? Got it. No, no, you should still get the pap smear, but also request again. I keep repeating it because I can't stress this enough to you to get the ultrasound. Okay, 2 years ago, I was having painful intercourse with my husband and pelvic pain. My African OBGYN ordered an ultrasound for my vagina, and everything checked out well, just menopause discomfort. Okay, let's see. And one more comment. Let's see what else is going on. My best friend was recently diagnosed with endometrial cancer. She pushed for further testing. Her doctor found a polyp during the ultrasound. No doctor has ever talked to me about a GYN exam, no matter the amount of pain I keep complaining about in my stomach. You see what I'm saying? Girl, it's very difficult to detect ovarian cancer symptoms due to mild symptoms, okay? So, as you can see, what she said in the video, they don't test again for everything when you get a pap smear. And as you can see in the comments and what I told you, make sure, make sure you get a transvaginal ultrasound. Again, it will not be painful at all, okay? And it will see everything, okay? If you have a polyp, polyps are not a small, polyps are a big deal. Polyps turn into cancer. So if they see that, they're gonna take a sample of that and test the polyp to make sure it's not cancer. They're going to look at your lining. If your lining of your vagina, your uterus, during your menstrual cycle, if it's too thick or too thin, they're going to take a sample to make sure it's not cancerous. They're going to look if you have fibroids in your stomach, your uterus, and everything, cysts, all types of stuff. Okay. And people are like, why come the doctors don't tell us this when we go in there? A lot of doctors don't say things. I don't know why. I actually heard of a woman who said that doctors told her she had allergies. Turns out she had cancer for 5 months. So you have to advocate for yourself a lot of times, okay? If you go to the doctor, ask them to get a panel, a blood panel, when they look at everything. When you go to the OBGYN, Again, tell them to give you that ultrasound and they'll set up the appointment. Very quick, not painful, and you will know what the hell is really going on in your uterus, vagina, all of that. They'll see everything, especially if you've been having pains down there and in your stomach and everything. Okay, so I just wanted to share this video, very educational video. I hope that it helps someone, and let me know what you think. Okay, so look, everybody, that is it for today's video. Please like, share, and subscribe. Hit the bell, click all notifications, and I will have more important videos like this in the very near future. You all take care. Bye, everybody.